and welcome to the McLaren Bariatric and Metabolic Institute. My name is Dr. Michael Kia. Today we're going to be talking about the disease of morbid obesity and the surgical treatment options available.
Hello, my name is Dr. Nicole Franklin. I am the Assistant Medical Director at the McLaren Bariatric and Metabolic Institute. By trade, I'm a board-certified health psychologist. I've worked with Dr. Michael Kia for over 15 years.
The McLaren Bariatric Institute is not just myself as a surgeon. We are a center that's dedicated solely to the treatment of the disease of morbid obesity. We're a team of specialty surgeons, dietitians, psychologists, nurses, and internists who utilize all of the resources available for us to treat the disease of morbid obesity. Before we get into the treatment of morbid obesity, we need to understand what is morbid obesity. Morbid obesity is defined as a progressive, multifactorial, life-threatening disease of excess fat storage with multiple comorbidities. It's today considered the greatest health epidemic of this century, and nearly 60 million Americans are morbidly obese. That's nearly 1 in every 5 people. It's the second leading cause of preventable death. About 500,000 people die annually, and today it's actually become the #1 cause of even things like cirrhosis. Morbid obesity is measured, much as your weight or your height, and it's actually a calculation, a relationship between your height and weight. And as you can see on this graph, this is a plotting of the ratio between your height and weight. And looking at this, you can identify what your body mass index is, your BMI. And that's a measurement that we use to determine the severity of obesity. There are varying degrees of obesity. In the pictures you can see, looking at different individuals, you can estimate their average body mass index. We define severe morbid obesity or morbid obesity with health conditions typically begins at a BMI of about 35. And as the BMI increases, so do the health consequences. Why do we become obese? Well, there's many different answers to that question. We live a relatively sedentary lifestyle. We make certain food choices. And these types of behaviors and factors contribute to us becoming obese. But today we understand that it's not just about becoming obese, but understanding why do we stay obese? We know that obesity begins as behavioral choices. But then individuals recognize this, people recognize, and they want to make changes. They want to return back to a healthier weight, a healthier life. And so they begin programs and diets and change their lifestyle. But the disease of obesity is a neurochemical disease. As patients become obese, they actually develop biological changes. There's alterations in the baseline levels of hormones that control your dietary habits. Scientists have studied these for years. There's many names for them. There's many different hormones. You may have heard of them, such as ghrelin, leptin. But really, morbid obesity is a dysregulation in how your body controls this release of these chemicals and how your brain processes them. The medical consequences of morbid obesity have been talked about for years. Diabetes, hypertension, high cholesterol, the list goes on. Many patients develop these diseases progressively. As the older we get, the more difficult it becomes for our body to cope with the disease of morbid obesity and the more health conditions we can develop. Most importantly, we know that there's a direct correlation between morbid obesity and the risk of death. It's exponential. And it's considered the #1 risk factor for mortality today in the United States. There are, as I talked about, many different medical treatments for morbid obesity. The most common are diets, weight loss programs, and medications. And for many patients, they've attempted this not just once, twice, but a multitude of times. So why do so many patients go through so many diets? And why do so many people struggle as they go through their diet? Well, scientists have studied this. they've looked at patients who undergo very low-calorie diets, go through weight loss programs, take medications, and in the short term, many of these can be very effective, and many patients describe 10, 20, or 30-pound weight loss. But when we follow these patients long-term, 6 months, 1 year, 2 year, 3 year, what we find overwhelmingly for almost all of these patients is that they regain their weight. And not only do they regain the weight they lost, they regain more. And so what we see is this cycle of yo-yo dieting, where an individual gains weight, loses some, gains back more. And this cycle continues. And with each attempt at diet, it becomes more difficult, the weight loss can become less, and the rebound can become faster and more severe. And now, the National Institute of Health, understanding that morbid obesity is a neurochemical disease, has recognized that surgical intervention, as all of the data has shown, is really the only approach that provides consistent long-term weight loss for patients suffering from morbid obesity. They consider candidates for surgery of patients whose BMI is 40 or patients who have a BMI of 35 but also have a health condition such as diabetes, heart disease, sleep apnea, or another severe health condition that impacts their quality of life. Briefly, we'll talk about a normal digestive system. When you eat food, it goes into your stomach, it mixes around, and it passes into your small intestine. And it's actually in your small intestine that the majority of calories are absorbed. Surgery works through altering the mechanism by those chemicals that are secreted that go from your small intestine to your brain. What surgery does is it regulates them again. It brings them back to a baseline. It brings you back to a point before the disease began. It allows the normal communication that was there to be there again. So that way, when you eat foods, you feel that hormonal chemical response back to your brain that you're not hungry anymore, that you feel full again. This is the return back to normal chemical balance between the stomach, the small intestine, and the brain. Surgery for morbid obesity is considered bariatric surgery or metabolic surgery. It's done laparoscopically, which is much better over traditional open incisions because of the faster recovery and less pain and shorter return to work. There are 2 types of surgical procedures that are most commonly performed here in the United States. The first is the Roux-en-Y gastric bypass. It's the most frequently performed and the longest studied procedure. It's been around for almost 40 years, and it's the most effective at correcting the neurochemical imbalances that allow for obesity to continue. The average weight loss is around 60 to 70% of a person's excess body weight, and it has an excellent comorbidity resolution rate. This is a video of the Roux-en-Y gastric bypass. It's performed laparoscopically through multiple small incisions. A small pouch is created at the top part of the stomach, about 3 to 4 ounces in size. It's separated from the remainder of the stomach, which stays in place and continues to function normally. The small intestine is divided, and it's brought up to meet that new small pouch that's been created, allowing us to bypass about 80% of the stomach. So when an individual eats food, it goes down into that small pouch and bypasses the great majority of the stomach and joins with the digestive enzymes in the small intestine. Nothing is removed, it's just the stomach is bypassed. The second procedure that's available and offered to a great number of patients is what's called the sleeve gastrectomy. It works by reducing the size of the stomach, and it also has the same and similar neurochemical effects as the Roux-en-Y gastric bypass. The average weight loss is slightly less, around 40 to 50% of your excess body weight, and it has moderate benefits for comorbidities. This is a video schematic of the laparoscopic sleeve gastrectomy. Again, it's performed through small incisions, about 1 centimeter in size. We place small instruments into the belly, and using these small instruments, we actually divide and remove the side of the stomach, reducing the size of the stomach down by about 60%. That portion of the stomach is permanently removed, and by reducing the size of the stomach, we alter the hormones that are secreted that control hunger. We also change some of the hormones related to that control things like your blood sugars and your desire to eat. When food passes down, it passes now into that smaller stomach and through to your small intestine. Your digestive system is unchanged in its direction and flow. It's just simply there's less stomach, and so you get this neurochemical benefit. In comparing the two operations, they are very similar in that they both are significantly improve a patient's clinical picture and help to resolve their morbid obesity. The gastric bypass, in most factors, has a slight benefit over the laparoscopic sleeve gastrectomy, an average of about 10% more excess body weight loss, and somewhat significantly more in terms of the resolution of diabetes. There are some reasons that we work with our patients where one procedure is better for them than another procedure, and on your office visit, we'll sit down and discuss with you in detail about your own personal health history and why one procedure may be better for you than another. In our office, procedures, surgeries, and treatment are tailored to the individual because everybody is a little different and everybody needs a specific treatment for their underlying health conditions. In general, for patients that have a lot of health conditions, the resolution rate for most general health conditions associated with obesity after bariatric surgery is around 70 to 80%. So when you look at things like high cholesterol, sleep apnea, high blood pressure, you can expect about a 70 to 80% improvement or resolution of these symptoms. For diseases like diabetes, studies have shown that the gastric bypass is probably the most effective of the procedures, and it has a resolution rate or a cure rate of around 65% to 70%, looking at all patients. As with any surgery, there are always potential risks. But in the state of Michigan, and even for the United States, we know that the total risk of the health conditions that patients have with morbid obesity far exceeds any risk of surgery for treatment of this disease process. In the state of Michigan, our data, which is very, very conclusively collected, shows that bariatric surgery is actually safer than some of the most commonly thought procedures such as hysterectomy, hip replacement, and even gallbladder surgery. One of the focuses of a safe operation is having a very experienced team that we have here at the McLaren Bariatric Institute. And one of our primary strengths is that not only do we take a patient safely through surgery, we continue to monitor them for months and years afterwards, making sure that they're successful long-term. I hope you enjoyed this educational video, and we look forward to meeting you in our office.
Our program is a gold standard industry-wide. We have worked really hard to make sure that we put together the best program for our patients. We follow up with our patients for over 5 years. We also provide them with services both pre and post weight loss surgery to make sure that they are able to reach their weight loss goals. After hearing Dr. Kia tell you so many wonderful things about our program, I'm sure you're wondering, how do I get to meet this surgeon in person? I'll tell you. The majority of our referrals come from primary care physicians in the community. We work closely with your primary care provider to make sure that we are working together as a team to help you reach your weight loss goals. Once you go in and talk to your primary care provider about your interest in weight loss surgery, they will send our office a referral notification. Upon receiving that notification, we will have one of our friendly administrative assistants contact you. During this initial contact, you will be able to ask some basic questions about the process, but more importantly, we get information about you so that we are prepared when you come in for your first in-person visit. We are already beginning at that first phone call to provide you with services that you will need to reach your weight loss goal. Our plans are individualized, and we are making sure that we put you first. At your initial consultation appointment, you will meet with our surgeon, our board-certified bariatric nurse, and our dietitian. At the meeting with the dietitian, you will be placed on a medically supervised diet. If you haven't already been placed on one with your primary care doctor, we will take care of all of this for you. During that initial appointment, you will complete a history and physical with our bariatric nurse. She will go over all of your history and make sure that surgery is the right option for you. In consultation with our surgeon, they will together work with you to decide which surgery is best for you. In addition, they will give you a thorough overview of the various weight loss surgical options that are available for you and will be willing to answer any questions that you have about the procedure and to calm any nerves that you may have about moving forward with weight loss surgery. We are here for you. We take the time during this appointment to make sure that you have time to ask all of your questions. We do not want you to feel rushed. This is a very important decision that you're making, and we want to make sure that you have time to consider all of your options and that you're able to ask all of the questions that you may have. The top 3 reasons that our patients choose to have weight loss surgery. I've been doing these evaluations for weight loss surgery and working in the business of weight management for over 15 years. The number one reason that I see patients want to move forward with weight loss surgery is they want to be able to be more active with their kids or grandkids. I've heard many stories about family members that have gone to amusement parks and unfortunately have not been able to ride rides that they wanted to ride with their family members. Oftentimes, when patients come back, the first thing they tell me is about various amusement parks that they've been able to go to with family members since they've lost the weight and how now they no longer have to miss out on the family fun. The second common reason I see people moving forward with weight loss surgery is they want their diabetes and other medical conditions to go into remission. Many patients come to our center taking a number of medications with the goal of reducing the list. A lot of our patients after having weight loss surgery, particularly our ones that have been diagnosed with type 2 diabetes, are able to leave the hospital no longer in need of insulin. That doesn't happen for all of our patients, but it happens for over 50% of our patients with type 2 diabetes. And that's amazing and a dream come true for a lot of patients who no longer have to poke themselves every day. The third reason that patients have been coming to have weight loss surgery, or the third top reason that patients have been coming to have weight loss surgery, is they want to be able to move on and be a suitable candidate for a joint replacement surgery. So oftentimes, orthopedic surgeons will refer patients to our clinic so that they're able to lose weight prior to having these other surgeries such as a hip replacement or a knee replacement. So we've talked about a few things. You've talked about the different surgery types. We've reviewed what the first consultation appointment is going to look like. Now you want to know, how do I get approved? Different insurance companies have different policies, but one common theme that we see is required is 6 months of medically supervised weight management. Your first appointment with the dietitian will count as your first visit. However, if you've already been doing this work with your primary care physician, we are able to obtain those records and use that information to help you get towards approval sooner. Another requirement that insurance companies often have is a behavioral health assessment. We also provide this service at our center. Oftentimes, however, when individuals come in, they are curious as to why they have to meet with a psychologist or a behavioral health specialist. Let me answer the question. Psychologists and behavioral health specialists help us do what we know we should do when we have a hard time doing it. Follow-up with behavioral health is a little different. When following up with the behavioral health team, the initial follow-up will happen within 48 hours of your operation. We will actually visit you in the hospital. We are one of the first hospitals in the nation to offer behavioral health services immediately post-weight loss surgery. You will not see the behavioral health specialist again until approximately 3 months after your surgery. During this time, we will talk about adjustment to life after surgery and discuss behavioral modifications that you need to engage in as you are modifying your diet and adding more solid foods to your routine. At 6 months, you meet with the behavioral health team again, and at that time, we'll talk about body image. At that point in your recovery, individuals are starting to notice your weight loss. People begin to ask questions. We help you have your answer to those questions. We help you feel comfortable about your body. We talk about surgeries after the surgery, and we talk about exercises to reduce the appearance of excess skin. Although everyone does not have difficulties with body image, everybody does have to deal with having a different body. At 12 months, we see you again, and at that point, we talk about relapse prevention. And one of the things I commonly say to my patients, and I'm sure you'll hear me say it if you come into our clinic, is just because you can eat it doesn't mean you should. And I mean that. As you get further and further out from surgery, you'll be able to add most foods back into your diet. So what we do is we work with you on how to add those foods back into your diet in a way that's not going to compromise the success that you've already achieved. You don't get to the 12-month mark without working hard. We don't want you to have any regrets. We don't want you to regress at all. That's why we're here, to provide you with that additional support. The follow-up that happens after the 1 year happens on a yearly basis, and we follow you, like I said, for upwards of 5 years post your operation. However, we do have ongoing support groups and a Facebook page that is available for you as long as you want to stay on the journey with us. Here at the McLaren Bariatric and Metabolic Institute, we appreciate the significance of the mind-body connection. We are here to treat your whole body. The first 4 letters in the word healthy are heal. We are here to help you heal your body so that you can engage in life the way you want. I'm excited for you to join on this journey. I hope that we get to see you soon at the McLaren Bariatric and Metabolic Institute.